And Dr. Sajita, can you go on mute? And if I can see you all, that will be better. It will be a great interaction. So I suggest all of you to switch on your videos and mute. So thank you so much for giving me this opportunity to read Dr. Vijayka sir's book. So today we are reading Theory of Suppression. We have been reading that for the past 3 months. We are going slow. We don't want to simply hurry up and finish off the books. There is no point in doing that. Word by word, we have to hammer in the ideas. We have to learn it thoroughly. That's why we are going into the basics again and again. And we are at the verge of finishing this book. So the next book we will be reading from the next class onwards. That is the third book, the theory of, that is the My Assumptions of Miasm. That is the third book we shall read from the next class onwards. In between, there is the second book of Dr. Vijayka, that is Theory of Acutes. We have done Theory of Acutes in our own way. During the COVID time, we had a lot of discussions about the acute cases. Theory of Acutes is full of acutes, like how the dull, chilly, thirsty, dull, chilly, thirstless, and then the dull, hot, thirsty, dull, hot, thirstless, and then the anxious varieties, and then the sleep mode varieties. We have done all those things in full, with full involvement long back, maybe during the COVID time. So we don't want to repeat that again. We will straight away go into the best book, that is the third book, that is the My Assumptions of Miasm, from the next class onwards. Today we will be finishing this book, that is Theory of Suppressions. For the first 45 minutes, let me go ahead reading the book. So we have been talking about the different types of suppression. So good morning once again. Welcome you all to the group. Are we all ready to go? Just give me some the chat box. Yeah. Are you all ready? Yes. So we have been dealing with the types of suppressions. Thank you. So that was like location to location. That is the skin diseases at one point. Okay. So a new eruption is coming up above the original lesion. That is suppression. If a new lesion is coming up below the original lesion and the original lesion itself is showing improvement, that is a good sign. If the original lesion is not showing any improvement and a new eruptions are coming up above the original lesion, that is the location to location suppression. The next one is organ to organ in the same system. For example, pharynx to larynx to bronchus, that is all the respiratory system. It is the same system, but then from one organ to the other organ to the other organ, it is going down and down. That is again another kind of suppression. The third suppression is system to system in the same layer. That is like from the respiratory system, it goes into the GIT. Like there was a bronchitis, and then the bronchitis is the endodermal thing. And it goes into diarrhea. Diarrhea is the GIT, but then that is again endoderm. And from there, it goes into a urinary tract infection. That is again the endoderm. So in the same level, in the same layer, the disease is transferring from system to system. That is from respiratory system to gastrointestinal tract, that is the digestive system, to genitourinary tract, that is the urogenital system. And the fourth kind of suppression is system to system in different layers. That is, if the patient is having a diarrhea, that is going into that is an endodermal disease like diarrhea getting better, and the patient developing hair fall or arthritis. So diarrhea is gastrointestinal system, and hair fall and arthritis is totally different. No, like that is the musculoskeletal system, and then the dermis involvement. That is the third layer. So the system is also changing and the layer is also changing. And arthritis is getting better and heart problems and endocrines are getting affected. Totally the systems are changing from arthritis to CVS, the cardiovascular system, and from there it goes into the various endocrinal diseases. So the layer is transformed from the layer 2, that is endodermal, to layer 3, that is hair fall and arthritis. Then layer 4, that is the heart problem. Then layer 5, that is the endocrine. So layer-wise difference and system to system difference. That is also a kind of a suppression. Then the fifth kind of suppression is the miasmatic transfer. That is from SORA, it gets suppressed into psychotic miasm. From there, it gets suppressed again into syphilitic miasm. No? For example, that was bronchitis, that is soric miasm for the child, and he gets better, but then he develops in the early, in the early adolescent period itself, he develops hypertension. That is a totally unwelcoming sign, right? So he is going into psychosis. And from there, he can even get lipomas and all. That is again psychosis. The first three types of suppressions are self-explanatory. We know all those things like location to location, organ to organ, system to system in the same layer. We are all thorough with that. And the last two are complex and are important. Let us go into that in little more detail. Are you all with me? Give me an indication like some thumbs up or anything. Yeah? All good? Now, layer by layer suppression, okay? As can be seen in conjunction with the chart, the disease transfer or suppression takes place from lesser important to the more important organ. So let us go ahead. From the knowledge of embryology, we understand that the ectoderm gives rise to the tissues or organs which are of lesser importance. That is the skin. And when these are suppressed due to any reason, they travel upwards to affect the tissues which have their origin in the endoderm. Example, like the respiratory tract, GIT, etc., and further to mesoderm. This we have been talking about this from the beginning. First, the skin is affected, that is the ectoderm. And when that is suppressed, it goes into the endoderm. It goes into the endoderm means either it can go into the respiratory tract or it can go into the GIT. And after that, it can leave the endoderm and go into the mesoderm. If disease affecting the endoderm derived organs are suppressed, they travel further inwards, that is upwards as per the chart, to affect the tissues which are derived from the third layer of the embryonic disc, that is the mesoderm. As we know, the embryonic disc contains three layers, that is the ectoderm, endoderm, and mesoderm. Out of that, so from the endoderm, when it is suppressed, it can go into the mesoderm. But in this too, those derived from the mesenchyme, that is the connective tissues like the bones, cartilage, and dermis, are of lesser in importance as compared to those derived from the mesothelium, that is parenchyma of organs and viscera. We are thorough with all these things, so I don't want to go in detail. It's all very simple. Ectoderm getting suppressed, it goes into endoderm. Getting suppressed, it goes into mesoderm. In the mesoderm, there is mesenchyme and mesothelium. Mesenchyme is nothing but the connective tissues like the bones, cartilage, etc. And from there, when it gets suppressed, it goes into mesothelium. That is the parenchyma of organs and viscera. So this layer to layer suppression does not occur easily, and hence homeopaths may get away with wrong prescriptions like mixtures, compounds, specifics, or even partially similar drugs till such time that the immunity of the person is not severely compromised due to various reasons. So what does this mean, guys? So here, let us deal this with an example. The patient is coming up with the throat pain. What medicine will you give? You can give any medicine, no? Any medicine will act. Belladonna, Rustox, Aramtriphyllum, Allium-Cepa, Ailanthus, Agrafisnute, any kind of medicine you give, and the patient is better within 2 days or within 1 day. What is the reason? Is it because you gave belladonna, it disappeared? Or is it because you gave ailanthus, it disappeared? Is it because you gave Allium-Cepa, it disappeared? For what reason did it disappear? Then what is the real medicine here? Yeah. So here the patient is in SORA. SORA is full of vitality. So he is having full immunity. His immunity is very good. So this is the reason with a Baptisia mother tincture gargle, or with some Aurelia mother tincture, or with some Justicia mother tincture, the cough is gone. How many days the cough took? for how many days the cough was there? For almost 4-5 days, or even for 7 days, the cough was there. And after continuously gargling Bactricia tincture, the bad sore throat is completely gone. And after continuously taking Justicia mother tincture, the cough is completely gone after 7th day. What is this? Is it a cure or is it a suppression? And why is the improvement then? You know that by giving mixtures and compounds and mother tinctures, you are not giving the dynamic medicine. What is homeopathy all about? Homeopathy is not like allopathy. Yeah. In allopathy, what we do is we give the milligrams, or we give the quantitative medicine. We first diagnose what the disease is. Is it a bacterial thing? Is it a viral thing? Is it a fungal thing? And then we give the anti-medicine of that, an anti-fungal or an anti-bacterial or an antiviral thing we give. That is how in allopathy it is followed. But in homeopathy, where is the question of quantity? There is no quantity thing in homeopathy at all. What about the mother tinctures then? What about the mixtures? What about the compounds? We have to use only single medicine, right? Single, simple medicine. Like our master has laid the rule. It should be a single medicine, and it should be a simple medicine. It is not a compound. It is not a multiple medicine, and it is not mixtures, and it is not mother tinctures. What are these mother tinctures? Why do we get relief when you take the mother tincture? The mother tincture is the very crude thing which we extract from the plant or from the root or whatever. And this mother tincture will have its action because of the quantity in it. That is the alkaloid in it. Like the reserpine alkaloid or the atropa belladonna, you have that atropine alkaloid, or in aconite, you have that alkaloid. And in all these herbs, in all these extracts, you have the alkaloids. And but is this alkaloid potentized? No. Then why do they get the why do we get the relief then? Why do you think that with the gargling or with the having the mother tincture, your cough is gone? Why is it so? It acts temporarily. Why is it so? It acts so superficially. Why again? Because it is correcting the biochemistry. It is just able to correct the biochemistry of the patient. Hence, when you give the mother tincture, it shows an action. When you give the mother tincture for urinary tract infection, the patient feels better. And when there is enormous bleeding, uterine bleeding, you give Sabina mother tincture, you give this, that, Laspebersa mother tincture and all, and you get actions there. Why is it so? All these things are temporary, and abruptly it will have an action for the time being, totally temporary. Is it like Ayurvedic Siddha? Exactly, exactly. Ayurvedic Siddha are all not potentized medicines. They are all very crude medicines, and they have their own limitations. They cannot act deep into the patient. They can never change a gene. They can never change the protein alignment in the gene. It will act very superficially. And as long as the immunity of the patient is good, the biochemistry is all good. The biochemistry is corrected by the crude medicine, and the patient is happy and the doctor is happy. So what does this mean? This doesn't mean a complete cure. This means again and again, if the same thing happens, it is going into suppression. So that is what we have talked in this paragraph. This layer to layer suppression does not occur easily. So the patient had come up with a chronic cough, and you had treated that with Aurelia mother tincture, Justicia mother tincture, this, that. The cough is gone completely. Again, the patient is coming back with a cough. You give the same kind of treatment, you give the mixtures, you give Drosera 30, this, that, everything you give. All in mixtures and compounds, and Dr. Bakshi's R compound, this compound, and all you give. The cough is gone. Then what happens? So if it is a suppression, what should come up? That is the second layer disease, right? The third layer disease should come up, no. Or at least a loose motion should come up, a diarrhea should come up. Why the diarrhea did not come? And why the arthritis did not come? Or why the hypertension did not come? The patient's BP is normal, the sugar levels are normal. And this doctor says that I have cured this patient. I have cured this patient. So what is this then? If it is suppressed, then the other symptoms should come up. No, the negative symptoms, it is taking its own time. So what is that time gap? The suppression does not occur easily. Why? That is because of the That is determined by the immunity of the person. If the person is having a very low immunity, or if the patient is having a syphilitic miasm, immediate, the suppression will be shown just like that. If the patient is having a rather good sora, or if the patient is having a very good psychosis, all these things will be camouflaged. Everything will be under the facade. So nothing will be shown out. There will be no immediate response, immediate reaction, or immediate jumping of the layer will not be shown. It will take its own time. It will be a slow kind of suppression. So until then, this doctor will be thinking that, okay, this is all cured. But then how do we know then? We have taken the case in detail and we understood that, okay, this is a case of ignatia. This is a case of chronic cough, and the patient is having lot of suppression and lot of grief. So this is because of the chronic grief that the patient is having months together cough. So I did not give any mixture. I did not give any compound. I did not give any mother tincture. I gave ignatia 1 m potentized medicine single dose, and the cough went away. Then how do you know? Is this a suppression or is this a cure? Tell me the answer, guys. But we have to wait, no. We have to wait, no. No reactions are there. And Vijay sir is saying in his book that according to the immunity of the patient, the next symptom is not come up. Arthritis is not come up. Nothing is come up. Nothing is come up. Arthritis is not come up. Or the next higher level of disease is not come up and the patient is all good and healthy. That is one thing, right? The patient is all good and healthy. Mentally, she is healthy, he or she is healthy, and he is able to do his higher purpose of existence. Everything is so good, but what is the missing point here? Hering's law. Where is the Hering's law? You have to hunt for the Hering's law. Okay, how did the cough disappear? First, that difficulty in breath is gone, and I'm able to sleep in the night, which means what? The syphilitic taint is gone first. The patient is able to sleep for the first time after taking ignatia, and the difficulty in breathing. What is that? For ignatia, sighing. That sighing is gone, which means the syphilis is again disappearing. And then there was little bit of cough for 2 days, and that cough also went off. And then there was little bit of mild cold kind of thing, and that went off. This is the Hering's law. So when you look for the Hering's law, scientifically you can find out that, okay, this patient is gone for a complete cure and this is not suppression. There you need not count the fingers and say, okay, when the arthritis will come, or when the hypertension will come, when the diabetes will come. No, you know that with this ignatia 1 m single dose, you have touched the cure there. Or eventually what will happen? Slowly, eventually there can be some rashes on the skin. Yeah, yes. So, so the suppression does not occur easily. Hence, homeopaths may get away with wrong prescriptions like mixtures, compound specifics, or even partially similar drugs till such time that the immunity of the person is not severely compromised due to various reasons. This is the reason why we always want to know the journey of the disease. The patient will not tell all these things. The patient will have already forgotten that he had the previous cough or cold and all that. What the patient will tell you? I'm having BP. I'm having BP. This will be the demand of the patient. How are you going to crack this? Okay, before BP, you had something, no? What was that? Did you have any? You know, which layer it is. What is the layer of BP? Hypertension, which is the layer? Give me some typings. No, I want some interactions from you. All are hiding behind the videos except Sufaira. Good girl. Sai Narendra, yes, if possible, okay, I'm not compelling you. And Atira also, yes. If possible, please switch on your videos, like if your situation permits. Yes, Arya Devi, Atira, Sai Narendra, Sufaira, everybody said that BP is the fourth layer. Very good. So you know which is the third layer, right? That is arthritis or anything which is coming up in the third layer. What are the other things from the third layer? Yeah, any knee joint pain or any laryngitis or any such issues were there before that, you can always ask. No, hi Gokul, and nice to see you. So you can always ask for what were the third layer diseases. You know, no, which are the third layer diseases. You can prompt them. Then they will say, yes, I had some injury. I had some cartilage tear. Yeah, I took some treatment for that. I did Ayurvedic massage or I did physiotherapy, and yeah, that was some 2-3 months back, and I'm getting breathlessness, and I checked the BP, and the BP was high. So you got to know one journey of disease, no? Yes, muscle, bones, and disease. muscles and bones are there. And before that, what had happened? Did you have any cold or cough? Or, yeah, in my childhood days, I had recurrent cold, cough, etc. So this is the journey of the disease, because you are treating the person. You are not going to treat the BP. So how did the person reach the fourth layer? A homeopath has to know that. You cannot ask for nappy rash. So just if it is the fourth layer, ask for the third layer diseases and then the second layer diseases, and slowly come into the nappy rash and all, which the person will not remember, right? Yeah. So this is the reason why we want to know the journey of the disease, because after suppression from one layer, the next layer of suppression will not be shown immediately. It can take some months' time, few months' time. And that is dependent upon the immunity of the person. This layer-to-layer suppression also forms the spectrum of the degradation of man from birth to death. So when we started this particular lesson, this is the last lesson of this book, Theory of Suppression, we have talked about death and the various methods of death, okay, the various kinds of death, no, various reasons for death also. And this is the reason of the disease also. If there is ease, there is disease also. So why is this disease coming up? That is to degrade the man. And finally, everybody will pass away from this earth planet to some other place. So for that, one disease is needed, either a cardiac arrest. There should be a reason for the end of life in this planet, no? Either a respiratory arrest or some asphyxia or some cancer kind of diseases. So how is this cancer kind of disease coming up? Not suddenly cancer. From the first layer, second layer, third layer, fourth layer, through the journey of the disease, the suppressions and suppressions and suppressions. This is what Vijay sir has said this. Layer to layer suppression. This forms the degradation of the spectrum of degradation of man. Man has to degrade. We are all mortals. So from birth to death. So this is the layer of suppression is taking us towards, slowly towards old age, and again slowly towards infirmity, and slowly towards death. So this concept can be simply explained in this way. The diseases of the level 1 and 2, that is the skin eruptions, the level 1 and 2, skin eruption, rashes, boils, and then the rhinitis, bronchitis, gastritis of the second layer are frequently observed in the first few years of man's life. That is usually or initially. What does this mean? We get children in our clinic, right? And children will suffer with what disease? Will they suffer from diabetes? Will they suffer from sixth layer disease, or they can suffer from epilepsy and all that? All those things will be of the psoric variety usually. But then nowadays in this Kalikalam, what we see, early psychosis we get to see, and early syphilis also we get to see. That is the reason why we are seeing so much of cancers in children, like leukemia, etc. We see in children also, no? And we are getting a lot of brain tumors and all for children, and we are getting motor neuron diseases, even epilepsy and other disabilities in children, etc. Yeah, leave alone all those things. Most of the kids, 90% of the kids coming to our chamber, what do they suffer from? What do they suffer from? 90% of the kids, what do they suffer?
Respiratory illness.
Yes, they suffer from the either atopic dermatitis or from cold, cough. Yes, exactly, Kyle Vidi. Cold, cough, throat pain, fever, skin diseases like eczema. No, so that will be there. Which one? Flu, etc. Diarrhea, etc. Very good. So these stomach pain, very good. These are all which layers, doctors? First layer or the second layer. Finished. So this is for children from infants till the age of 10 or 12. They will suffer from these diseases only. And then the next paragraph is, the third layer diseases usually manifest in the teenage or young age. Example, joint pains or psoriasis or hair fall, slip disc, spondylitis, spondylolisthesis, etc. See, adolescent age. What will they do? They will go out for the play. They will fall there. They will do the basketball. They will fall on the ground while playing the football. They will have a tear, a meniscus tear. and they can get some, they did the neck in the football, and then they will have straining of the neck, and then they will be having that spondylitis, or they can have the slip disc. By the way, slip disc is what, miasm? Spondylitis, spondylosis, spondylolisthesis, slip disc. Come on, differentiate that quickly. Spondylitis is, everybody knows itis. Okay. So spondylitis is psora, and that is the inflammation of the disc. Yeah. Okay. Spondylitis. Now coming to spondylosis. What is spondylosis? Yes, spondylosis is nothing but it is a common term. It's a generalized term that is meant for age-related wear and tear. So any wear and tear, what is wear and tear? Otherwise known as wear and tear means destruction. Destruction means which miasm? Syphilis. So all kinds of spondylosis are maybe psychosyphilis. It is psychosyphilis. And slip disc. What is the slip disc? So there is a vertebra and a vertebra below, and in between you have one rubbery cushion there, and that rubbery cushion is out of place, or it is not out of place. If it is out of place, it can be the syphilis also. It is slipped. It is herniation. It is herniated. Herniation means which miasm? Or it is rather bulged. It is displaced. Yes. That is also again psychosis going into syphilis. If it is touching the nerve and there is excruciating pain, it is syphilitic. So it is psychosyphilitic. Herniation, bulge, or disc prolapse. Prolapse is again psychosis miasm, right? And next one is spondylolisthesis. What is this? Again, you know, there is one vertebra and then there is a vertebra below. In between, there is the disc. And what happens to this disc? The disc is gone and the vertebra slips and it stands upon the other vertebra. Like this, it stands. This is one vertebra and the other vertebra. One bone is standing upon the bone below that. This is spondylolisthesis. One vertebra is standing upon, yes, disc indentation, sequestration. Sai Narendra is saying something. Let me see. Let me see. Sequestration. I don't know what is the sequestration is. Disc indentation and miasm. Miasm is psychosis only. Miasm is psychosis. See, indentation means it is all compression. It is all compression. Any problem with the disc is initially it is psychosis, and then according to the severity, according to the touching upon the nerve and all, it goes into the syphilitic thing. So to begin with, it is psychosis, slipping of the disc and herniation, protrusion, all these things are syphilitic. Whereas spondylolisthesis is psychosyphilitic because the disc is not there for protection. The disc is the shock absorber. That is not there. It has already either slipped away or it has protruded or something had happened to the disc, or the disc is rather or indented, or the disc is compressed, and what happens, the vertebra is not able to stand in position and it slips over and it touches the vertebra below it. One bone standing upon the bone below is called the spondylolisthesis. That is psychosyphilitic. Stenosis. What is stenosis, Sai Narendra? It is psychosis, narrowing. That is stenosis. The lumbar canals and all, no, the spinal canals, the canals can get stenosed. And what happened? The blood vessels will be kinked and the nerves also will be kinked. So joint pain, psoriasis, level 3. Level 3, joint pains. Psoriasis is level 3 again, right? That affects the dermis. All these things, like it starts as a dandruff. The teenagers will come as a dandruff, lot of dandruff and lot of hair fall. So that is all the third layer. This comes for adolescent children up to the age of maybe around 25 or 30, even it can go beyond that. Now coming to the fourth layer disease. They are seen in the middle age, that is from the 30 to 50 years, but more often than not, the expression of the disease changes from simple inflammation to induration of the organs and systems, or even destruction of organs is the change in the expression of disease. The type of disease changes from spondylolisthesis to atherosclerosis of the CVS, producing hypertension. Rheumatic arthritis changes to gout. This is exactly what is meant by miasmatic transfer or miasmatic suppression. So what is this now? So what we said was children will get the psoriatic diseases, and from layer 1 and 2, 90% cases. There are exceptions in high psychosis and early syphilis. Then the adolescent guys will be getting the diseases from the layer 3. And according to their psychosis, they can even get early hypertension or early diabetes. But then usually for adolescents, it will be dandruff, or it can go into psoriasis, or it can be some joint complaints, no, like ligamental tear, etc., etc. After that, the 30 to 50 age group, what all diseases set in? Anybody will be getting a sugar, high sugar, or anybody will be having a high cholesterol levels. Anybody will be having a thyroid level. Anybody will be having, if it is ladies, they will be getting the PCOD thing also. And of course, that comes even much younger also. In the adolescent age itself, the PCOD starts. And I want to tell something else also here. Hypertension, cholesterols, diabetes, thyroid, all these lifestyle diseases come upon 30 to 50 age, middle-aged people. And according to the miasm, the expression changes. If they, mostly it will be psychosis. Or if the syphilitic trait is there, then it can go into the higher levels as well, like into malignant hypertension, or very high wavering, fluctuating sugar levels. One time it is 400, the other time it is 200, or it is 400 above always. So according to the syphilitic miasm, the intensity of syphilitic miasm, the expression will change. But then we get all these fourth layer diseases, fifth layer diseases. Fourth layer is the CVS, fifth layer is the endocrine disease, and then the sixth and seventh and all in the very old age. In the normal cases, sixth layer and seventh layer are in the very old day. Very old means what? Above the age of 50, maybe from 60 to 70 and all, you can get all the Parkinson's complaint and all, no, for old age people. Or forgetfulness will be there, or senile dementia will be there. As the name indicates itself, the senility, because of the senility, all those atrophy of the cerebrum can be there. Memory issues can be there, or even schizophrenia can be there, or behavioral changes can be there in old age persons, or it can be some neuro complaints. So all these things are affected 60, 70 years above. So this is how the disease progresses into death, towards death. So, and how the miasmatic transfer happens from SORA to psychosis to syphilis. In younger age, there will be more of SORA. In the middle age, there will be more of psychosis. And in the later ages, degeneration sets in. All the hair becomes gray and all the bones become wear and tear. This is the aging process, natural aging process. Yeah. So miasmatic transfer or suppression, the next paragraph. Any doubts? We don't want to rush. Any doubts? That is our motto. We don't want to rush. Any doubts then?
Ma'am, the last line, it is told us this is exactly what is meant by miasmatic transfer or miasmatic suppression. Actually, it is layer by layer suppression, no, ma'am. That's what we are reading.
Layer by layer and miasm by miasm. What is the miasm for the children? 90% of the children, the miasm is SORA. And for the middle-aged people, 90% cases, it is psychosis. And the old age persons, 90% it is syphilitic. So the miasmatic transfer is also happening. Without syphilis, nobody can die. With SORA, it is only giving birth. It is for SORA, it is growth and giving birth. In psychosis, it is multiplying. And there is no growth of height in psychosis. There is gaining in the weight in psychosis. In SORA, the growth is there. Growth is there. And after the psychosis, what sets in? The syphilis sets in. And there again, your skin and all, no, everything will become shriveled and all the fat is gone and you will be also bent and crooked, and then the typical old age appearance happens. So, and after the syphilis only the death happens. So disease is progressing layer by layer to death. And miasm is also from SORA to psychosis to syphilis, and that is going towards death. So every man is born and it is going, the life is taking them towards death day by day. This is what we started in this chapter. Okay, Kayalviri? Hope it is clear?
Yes.
Brahma Vidya. Can you go on mute? Seventh layer miasmatic diseases. Seventh layer, which are seventh layer, ADHD, autism, Parkinson's, All these diseases have its own miasm. It can be the SORA, it can be the psychosis, it can be the syphilis, all according to the gradations. Yeah. Yes. Behavioral changes are all in 7th layer. So the miasmatic transfer or suppression, this is according to me the most important of the disease transfers. It is also the least understood. Yeah, we are coming here, Kyle Bidi. If a physician understands the base of miasmatic suppression or transfer, the world of knowledge will unfold before them. Until now, we saw a certain type of expression from one organ to another, say infection or inflammation being transferred from one organ to the other. That is eczematous dermatitis may be transformed into rhinitis. Till the level of infection and inflammation is mild, the body tries to regain the normalcy of functioning or homeostasis. That's nothing, doctors. Now coming to SORA, that is plain inflammation, the benign inflammation, may or may not be because of infection, arises out of deficiency on the part of organism, deficiency in the normal functioning of the organism. This deficiency, or rather diseases finding their origin in this deficiency are soric. It is again and again the same thing. All the inflammations, all the infections, and all the deficiency are soric. Now next, coming to psychosis, the thickening, okay, the collection, hardening, induration, chronic greenish yellow discharging inflammation, or inflammation giving rise to induration are all essentially psychotic in nature. Hope you are with me. Yeah. These also include diseases which are insidious in their onset and manifestation, which remain hidden for long before they can be detected. Example, diabetes, hypertension from atherosclerosis leading to cardiac ischemia are all psychotic in nature. Psychosis is a time bomb, right? The patient is with BP 150/120. How long can this is a typical psychotic BP. How long can this patient go? He can go as long as his psychosis allows him to go. Suddenly he will, with one blow, with one some emotional blow, maybe his some bad news happened in the family, and this patient will jump into the syphilis immediately. He can suddenly have the cerebrovascular accident or stroke, or ischemia, and he will be admitted in the hospital, right? That emergency comes in. So that is the psychotic miasm. It will be hidden. The 150/120, no symptom, no symptom. Why should I take medicine? Diabetes is 400. Why should I take medicine? I will take Siddha, I will take Ayurveda, I will take homeopathy. I don't want to take allopathic medicines. And what is the sugar level? It is 400. How long will it take you in that? As long as your psychosis allows you, you will have no symptom. You will be asymptomatic. You will be all happy and all. But the disease is under the facade. Everything is covered there. That is hidden, and that is psychosis. Syphilitic miasm, you all know, destruction of organs or perversions of functions, lawlessness, and distortion are all expressions of this miasm. Ulcerations or destructions which have distorted or ragged and jagged edges, or which cannot be delineated, are syphilitic. All the ulcers which are having ragged edges, jagged ulcers, torn, broken, lawless, distortion, perversion are all syphilitic miasm. All psychotic conditions finally end up with perverted functions or destructions of different organs. That is, they have a syphilitic end. The psychosis goes on and on. Everything is all fine. But then suddenly comes in the syphilis and it will be really bad. No? Thus, we see how the journey of disease usually takes place in the human body. And from this, we can also conclude that not only should the cure take place from above downwards. Are you all with me? Inside outwards. From more important organs to less important organs, from center to periphery, except in disease like measles, chickenpox, herpes. Yes, in measles, chickenpox, herpes also, it disappears from center to periphery only. In the reverse order of appearance of symptom, here we get except the viral diseases. In the viral disease, it is not in the reverse order. It is in the disease appearing order only. The disease disappearance also happens in the same direction. Hope you are all with me. And then the last thing is from the more destructive miasm to the lesser destructive miasm. That is, that this is a corollary which Dr. Vijaykar sir has added. That is, from the syphilitic miasm, the disease has to come down to psychosis, and then it has to come down into SORA. Is this possible? Syphilis is taking you towards death, And from that, is it possible to bring the patient back to psychosis? And from there, is it possible to bring the patient to SORA? Arya Devi is saying yes. Who all? Shubhangi is saying yes. How many of you have seen this beautiful evolution from the death back to life? How many of you have seen in your clinic? Adira has seen, yes. Give me a hand raise now. How many of you have seen? Is this possible? It is very much possible, guys. Now, I don't want to take the time of Dr. Gokula Krishnan. That's why I'm Gokula Kannan. That's why I'm hurrying up. So this corollary is Dr. Vijay Sir's addition to the Herring's law of direction of cure. According to him, this should be given a lot of weightage in viewing any follow-up. Is this syphilis? Is this psychosis? Is this SORA? This will help you in the mathematic calculation. So if we now compare this with a chart given, so what is the chart? So there is a chart, no? There is a chart in the back of the book. So disease travels from below upwards and from left to the right. From the leftmost is the SORA of the chart. Leftmost of the chart is SORA. The middle area is the psychosis and the rightmost is the syphilitic. This is how Vijay sir has arranged the chart for our reference. This is a desktop guide, desktop chart. And the disease is traveling from, the arrow mark will be upwards, from below upwards. Conclusively and logically, how should the cure be? The cure should take place not only from above downwards as per the chart, but also from right to left. The rightmost is the syphilitic. So from the right, it has to come to the SORA. Right is syphilitic, middle is psychosis, leftmost is SORA. So disease should be from left to right, and that is the miasmatically. Cure should be miasmatically from rightmost to left. And disease will be layer-wise from below upwards, and cure should be layer-wise above downwards. So this is how Vijay sir has made the chart all by himself. Kudos to him. Then, by this, I mean to say that only bringing the disease to a lower level is not sufficient. It should also be brought down miasmatically from structural changes to functional changes. Okay, I have brought down the disease from the fourth layer to the third layer. Fourth layer, it was only a labile hypertension. It was only a fluctuating thing. And now it is a destruction of the joint, a total wear and tear, total destruction of the joint. So this means it is not a good sign. From the fourth layer, the disease has gone to the third layer. But then the miasm is gone from SORA to syphilis. That is also not good. Yeah. The knowledge of the different types of transfer of diseases is essential to every homeopath, because only if he is aware of such a thing, he shall be able to see it in his patients. In short, eyes do not see what mind does not perceive. Conclusion. The sequences occurring during cure are a mathematical certainty. How many of you agree that? Is it a mathematical certainty now? Yes. All homeopaths should leave their extremism, which lead to unsure and unpredictable results, and opt for totalistic homeopathy, by which results are sure, predictable, and mathematical certainty. So here we conclude this book. Any quick doubts? Any quick doubts? We don't want to go ahead with doubts.
I have one doubt. How can we differentiate between pityriasis and vitiligo rashes, and how we can, what is the approach between these? And
pityriasis is nothing but an ectodermal disease. Vitiligo is the fifth layer disease.
Okay.
Yeah.
But the rashes are white spots, like rashes will be there, no? So it will be confusing.
Yeah. That you have to know. Yes, that you will have to judge and find out. Like how maybe you can take the images from this chat GPT or from the Google. No, you use Google for all those things. How will the pityriasis be? You go into many images, and then you will know how to differentiate pityriasis with vitiligo spots. Sometimes that can be confusing. If the vitiligo spots are so small, then sometimes you will be confusing with the pityriasis. Yeah.
Then what could be the conflict?
Kyle Vidi is giving a most important input. That is, itching will be more and better. Thank you, Kyle Vidi. Yes.
Yeah. And more than that, melanin pigmentation also less now. So in both cases, melanin pigmentation is less. So whether it is The same conflict we can ask in that case.
In pityriasis, you can ask for anger irritations because the itching will be more and it is more a superficial disease, whereas vitiligo is much more deeper. For vitiligo, you will have to always ask for attachment detachment. Means you are attached to one person and from that person you are detached. That is the cause of conflict for vitiligo. Whereas for pityriasis, it will be some verbal conflict or something like it will be more superficial in pityriasis. Okay.
Ma'am, I have one doubt. Can I ask you, ma'am?
Yes, yes.
Ma'am, in general PCOD cases,
Yeah.
where the androgen levels and testosterone levels are very high.
Yeah.
So after primary fertility,
Mm.
so female was not getting regular menses. So we generally we take time passes too slowly, and then confusion of identity. Along with that, can we, since the follicles are not maturing, can we take the delusion injury, madam? In such cases, delusion injury will receive.
Why is that? What is this is it a primary infertility case?
No, madam, no, madam. It's not the
The-
infertility case.
Okay.
She had the first, she conceived firstly. So after that, she went into PCOD.
Okay.
So this
You have found out that the androgens are on the higher side, so you have taken the identity conflict and identity, that is the confusion of identity rubrics and all. But then why do you want to take delusion injury will receive? Because you are thinking in that angle that the follicles don't want to rupture, right? Good thinking.
yes, ma'am.
Good thinking. Good thinking. And even I have tried with borax. Let me give you this input to you, doctors, because when you do the follicular study in such patients, the follicles are getting developed and day by day, every alternate days you do know on day 11, day 13 and day 15, you ask them to repeat the follicular study and the follicles are getting matured day by day. Endometrial thickness is getting matured day by day, thicker day by day. But finally what happens? It will not rupture. It will not rupture. This is happening in PCOD. So for it to make rupture, for it to rupture, you can that you can always take this delusion injury, as you said, or you can take this fear of fall. After it is ruptured, then there will be a kind of a fall into the pelvic cavity, and from there only the fallopian tube picks it up. No. So fear of fall, and accordingly, I have given borax, and it has worked. It has worked. Why patient?
Yes.
Is it
Thank
clear,
you, madam.
Samarendra? You can
Yes,
take
madam. Yes, madam.
consider this rubric. It is a good one. Delusion
Yes,
injury, because that rupture can be considered as an injury. If the patient is having some fear in her about injuries, you can always take that. Good
Thank
interpret.
you, madam.
Potency. Potency is 200. 200 single dose is enough. Why patient wants to become man, need to understand. I didn't understand, Shubhangi. Yes, in testosterone. In testosterone case, Sai Narendra, this is an input to you because it is a lady. So why the testosterone? Why does the patient want to become a man? You have to probe in that way. So that is also one input. So
Yes, ma'am. I probed,
you
ma'am.
can use that. Yes, yes. For that only you have taken the confusion of identity. That's good.
Yes, ma'am. Yes.
Now, are we good to hear Dr. Gokula Kannan? A very good doctor, very experienced doctor, completed SCPH and SCPH plus, etc. Warm welcome, Gokula Kannan, my friend. We had a group study at Dr. Kugapriyan's place, and we all had nice chats sitting all close by. We had excellent memories. Warm welcome, Gokula Kannan. So proud to have you here.
Thank you, madam. I'll just share my screen, madam. Okay.
Yes.
My screen is visible, madam. Am I audible?
Yes, yes.
Please proceed, Gokulakandan. Good.
So just I am discussing a small case, a couple of infertility. So uh, the wife has that PCOS. So just I want to just put a quick note of how is your approach. Then we will go to the case so that it will be easy. As just now, ma'am has discussed and everyone has discussed. So the same input only almost. So the main thing is we have to see whether it's menses issue has started from puberty or it's after it's started later. So if it is from the puberty, we have to more focus on the childhood nature, or even we have to get a history of mother pregnancy. That also will give some clue. And if the menses issue have started very late, that only that time we have to give more focus. Uh, that's the main thing. And most of the things, the SORA also we have to consider in these cases. Generally, the main we have to differentiate in a two-way whether why the woman don't want to mature. That is whether the childishness or whether it's a mannish habit. Okay, so that's the two thing we have to see. If we are very clear on that, the case will be very easy to crack. Uh, so for maturation delay or those things for childlessness, whether we have to go, whether it's a history of abuse was there or marking history of marking, whether it's a very dependency, clinging, and helpless feel, and the childish behavior and responsible aversion. Those will give a clue whether the person is more towards the childishness, and we can crack whether what is the thing we have to get very detailed, and whether and also the trauma during the childhood, whether the parents can fight or whether the child is very timid and introverted. Okay, these are the little gist, so it will be very easy to understand our cases also. So it's a case of infertility. The couple married 4 years but not able to conceive. They visited on 22nd October. For female, the menses appeared 2 or 3 months once. The flow was very scanty and painful menses also there. And menses irregular only after 6 months of marriage. She said earlier it was regular, only after marriage it has started to regular. And ultrasound was suggestive of PCOS, and I just gone to her nature and all. She said she gets anger very easily, don't want to conceive using any medicine, so she waited for 4 years. So 4 years she was trying. She said I don't want to go any medication, I want to conceive naturally. So she was trying, but almost after 4 years they have visited. Childhood nature very active and jolly, and used to beat people if they didn't listen to her. Not much interested in studies also. And she said, in childhood, I used to say very frequently lies and all I used to say, but she said without any hesitation to me. And dreams about ghosts and accidents happens. And after marriage, she said her husband sister have died earlier in the house. So she believes there is a ghost in the house. They said in the house that sister is there, she died in the house and all those things. So she start to believe there is a ghost in house, and she afraid to stay alone in the house. If there is no one in the house in the night, she whole night she used to keep light and awake in the whole night. Okay. So this is the history of it's a small case only I have kept. Okay, so uh, in the case just by that we can see whether it has started only after marriage. Those can't we have to get only the history after the marriage. Husband sister was died. She was very fearful in the house and all those things we have to see. So generally, I will see that PCOS cases in two way. Where once I have taken the case, I will see whether how developed the person is, whether she is very childish nature or whether she is well developed. Uh, she said right from the history, she said she don't want to conceive without taking any medication and all. And she is very active. She is even used to, if they don't listen, she used to beat and all. So I thought she is little bit developed nature. By nature, she is little bit developed nature and all. And the conflict we have seen is that she is having a fear of the ghost now, and constantly afraid to stay in the house and all. So the rubric I have taken, the delusion, spectators, ghosts, spirit sees. And basically she used to say lie and all. So I have taken as a moral feeling want of, and female menses painful and non-religion remedy. So those things I have taken. So the remedies I got is the veratrum, ammonium carb, and the hyoscyamus tarantula, lachesis, merc, natrum group and all, opium. If you see in this veratrum always will have the childish nature will be there, even though they are king, booster, boasting, all those things will be there. They are actually inner side, they are not much developed person. And hyoscyamus also, there is always the childish nature will be there. Tarantula, lachesis, and merc are much developed. In terms of development, they are much more developed remedy. The natramure and opium also not much developed. They always will have that childish nature will be there. So just the feeling of constantly being attacked and all. So I thought the snake remedy will be a better choice. So Crotalus Cascovella 200 weekly doses I have given for 3 weeks, and then I have given only the SL. Okay. So this is about the female, and for her husband, for the male infertility, if it is an azoospermia or areospermia, so we will sometimes we will consider this an autoimmune also. And the conflict is we want to go through why don't want to be a father, or identity conflict. And teratospermia, we have to see more of what is the identity conflict in the person. Okay. So the husband is 32 years. The sperm analysis shows that teratospermia, it's an abnormal morphology of the sperms. So the history wise, very weeps very easily, dreams of traveling, feels happy about it. And so her sister only committed suicide at the age of 16 years. So he was very attached to her sister. But in his house, an astrology told his father that it was because of his son horoscope only your daughter has died. That's what the astrologist said. So his father used to tell him, because of you only, your sister has died and all those things. So I asked, what do you feel about that? He said, yes, I am the reason, because of me only she have died. So this is the history. So I thought to go more in the identity conflict. That's the thing I want to focus on that. So mainly I have taken the rubric delusion. She has murdered someone. That's the rubric I have taken. So in that, arts and phosphorus was the issue. So more related with the identity conflict, I have given phosphorus 0/6 daily dosage I have given. So in that 23, they had the pregnancy positive happened. So that's the end of the case.
So indeed, it is a very good case, Dr. Gokul. Hats off to you. See, actually, this is a very tough case. PCOD and teratospermia, husband and wife, both of them are having problems, and it's an infertility case. It is actually a tough case to crack, but then you have made it so simple, Gokul. And you have made the gist you had made, that is really superb. The entire PCOD will be a big facade, and it will be like a big blown up thing. You have made it so simple, and what to pick and what to probe, you have made it so clear. And even in the teratospermia, super, excellent. And you evolved into Crotalus cascavella for the lady, and phosphorus again for the guy. It's, again, really hats off to you. And the result has also come up there. Let it come to a full blown good embryo, good baby, good fetus. And we want to see the photo of the baby, okay? After some 6 to 7 months after delivery, yeah? So let the good thing happen there.
Excuse
And
me.
yes, Brahma Vidya.
I'm recording that case. In phosphorus, we have given 50 millisieverts 0/6 directly, or how I have chosen that potency, ma'am. 0/6 phosphorus.
No, generally from our textbook, generally we have to go from 0/1, 2, 3 like that. But generally most of the cases, I will start if it is not an acute, I will start from 0/3, then I will shift to 0/6 if needed. I won't go for if I feel there is an possibility of aggravation. If the aggravation can't be bear by a patient, then I will usually slow by next one 0/3 to 0/4 like that. But sometimes I will because I feel if there is won't be a significant aggravation, and that's the thing I will go because recently I have a case of psoriasis. I have started from Pareto bar 1, but the patient have responded only on Pareto bar 10. I have shifted to 2, 3, 4, 5, 6 like that. So it's because two things I will see whether but from the history of sensitivity, how sensitive it is, but from past history, the patient sensitive to acute illness. If they have the history of very severe acute illness, I will see whenever the disease condition comes, the patient is prone to collapse and all those things. I feel, because we are also giving an disease agent, right? So if they are able to bear the aggravation, then I will usually shift 3, 6 like that. If it is not a case, generally I will go for 1, 2, 3 like that.
Thank you, Gokula Kannan, for that input.
Thank you, thank you.
Why Crotalus cascavella?
Yes.
Can you explain, Gokula Kannan?
Yeah. In a snake remedy, if we see right, generally, if it's a non-poisonous snakes and poisonous snake group is there. Generally, if a non-poisonous snakes are not much developed, like a python, anaconda, and the boa, those things are even a snake remedy comes also. If you feel there are lot of childishness there, then you have to think these non-poisonous snakes, this boa or python, anaconda, those things are not much developed in a snake category also. And if you see this, then if you see the poisonous snakes, we will differentiate into Elapidae and Vipridae. Elapidae is more of an emotional thing will be there. Emotional, it's like an emotional dependency will be there, and they will be their conflict is more related to intuition. Territorial conflict will be more on Elapidae family, like a Naja or these Elaps, all those things will have more related to this territorial conflict will be there. And this Vipridae, it is more of an attack and all those things will be there. It is constantly being felt like being attacked from other people. This Lachesis, Crotalus, Cascavella, Horides, and all the things will be more related to this one. And this Cascavella has the predominant symptom of the ghost related delusion of ghost and all. It's predominantly in the Cascavella, so have given that.
Excellent. Spirits, ghost, God communication, more of Crotalus cascavella. Yes. Excellent, superb. So it is not one case presentation, it is 2 case presentation and a discussion of millisimal potency as well as a gist upon PCOD, teratozoospermia, as well as it was Ophidia. Hats off to Gokula Kannan. Thank you so much.
Thank you.
So can we call it a day? Can we wind up here? We shall all proceed again, see again in the next class with the third book of Vijay Kasar, that is My Assumptions of Mayasam. Thank you so much, guys.
Thank you, ma'am.
Thank you, ma'am. Thank
Okay.
you.